If you're a breast cancer patient and you are trying to get out and do that walking like everyone's telling you to do, but you're finding it a little harder than you thought, and you are getting that hip pain or knee pain or ankle pain, then you need to stay tuned to this week's Monday Moves with Marion. If you look on the websites, if you read the brochures, if you see the pamphlets that are being handed out, what you see is breast cancer patients are being told to work their way up to 150 minutes a week. And this includes some vigorous activity. You are told that you will feel better, you will decrease risk of recurrence, you will keep your weight down, and you'll feel better mentally and emotionally if you go walking. That's a lot of pressure to get your butt out the door and go walking. So let me take you back and just explain for a minute. We know that walking is a good form of exercise. We know it helps with cardiovascular health. We know it helps get the blood flowing. We know it can help with mental health issues like depression and anxiety. Yes, walking is all of that. But that doesn't mean that walking's right for you. So if we use a whole blanket to say all breast cancer patients should be walking, all breast cancer patients should be exercising more, I think we need to give breast cancer patients and survivors and thrivers a little bit more information. So when it doesn't turn out very well, when things start to hurt like your hips and your knees and your ankles, then there's a lot of pressure on you to say, hey, what's going on? I want to feel better. I don't want to feel depressed and anxious. I don't want to get breast cancer again. I want to get my weight down and I want to get back to all the activities that I love, but I can't go walking because everything hurts. So let's take a look at this body that you want to make active. Has there been any changes since diagnosis? Well, you bet there has. Absolutely. Whether it's surgical changes, chemical changes, chemotherapy, radiation, lumpectomy, mastectomy, you've had tons of changes that have made for changes in your body. Not only with systemic things that may occur with peripheral neuropathy and osteoporosis, it could be changes too that have occurred with increased weight, decreased muscle strength. Your appetite may have changed and you don't have the nutrition in your body for those muscles that are working. You may have started to compensate if your shoulder hasn't been moving well. Your posture has changed since surgery and treatment. When you go out and walk, all of those changes are coming with you, and it's going to change biomechanically how you're moving. And this may be at the basis of the aches and pains that you have. So for someone to say go walk 150 minutes, but they haven't checked how you're moving, I don't think that's smart. So I'm telling you, don't go walking until you check your foundations. Now, what I use with my patients in the clinic or online, what I use for myself, going through all the rehab that I've gone through with my 5 shoulder surgeries, with my knee replacement surgery, and now trying to rehab after my car accident, what I do is set a goal, and then I use the Foundations First framework to figure out if I have any issues in reaching that goal. If my movements, if my body, if my strategy to reach my goal, and let's say this is a 20 minutes of walking a day that you want to do, if I can't reach that goal, then there's a deficit. There's something that's holding me back. And if your body's giving you those signs and symptoms of aches and pains, then you know for sure there's a problem. And we need to figure out what it is. We just can't tell you to go walking. We can't say hit that 150 minutes, start slowly and just keep working up. No, your body's giving us a sign that something needs to be worked on. So let's go back to the foundations. Let's see where we're at before we start leveling up. Your body's giving you the signal that something is not allowing you to reach those goals. So we need to break this down and get to the foundation of your goal. For walking, we're looking at those ranges of motion. And today I want to talk to you about the ranges of motions in the lower extremity. That is your ankle, your knees, and your hips. We need to look at how those joints are moving before we look at whether you have the stability to go walking, whether you have the strength to go walking, and whether you have the endurance to go walking. We need to look at those joints because there's been a lot of changes in your body. So we want to see that your ankle is able to move without pain. And there's 4 movements in that ankle. So I want you to test those out and see if you have any pain with ankle movement. Let's go on to the knee. Your knee is a hinge joint. It only moves in flexion and extension. If you're seeing anything online that's telling you to work on your knee rotation, say no, don't do it. Your knee doesn't work in rotation. Just leave that alone. Flexion and extension, that's all I want for your knee. Find out, does it hurt? Can you do it? Is there any problems? Then we're going to go to the hip. The hip has 6 different ways it can move. Yeah, it's pretty complex. So we need to look at those movements. We need to see if you've got good range, pain-free range, and if that is something that's holding you back when you walk. You may have peripheral neuropathy. You may have balance issues. You may feel unsteady with changes in weight. You may feel unsteady with how your body's now balanced, and your steps may be a little different. They may be shorter. You may be compensating. You may set a wider base of support. All of these things can contribute to aches and pains in those joints. So we have to break it down, and we have to see that you have good movement in the joints before we're going to level up to the next stage. So I've put together a little something for you so you can take a look at those 3 joints we just talked about. Check out how those joints are moving. And then next week, I want you back here. I want you back with Monday Moves to take a look at the other joints, not in the lower extremities, that are affecting your walking. Now, don't you dare say to me that, nah, my shoulder movement isn't going to affect how I walk. Oh, yes, it is. So stick with me. Let me guide you through. And we want to make sure you can reach your goals. And we're going to break it down to the foundations and get you to your best potential. If you have any questions on how to walk well, if you have any questions on the ranges of motion that we talked about today, send me an email or a DM. I am more than happy to help. I want you to hit the subscribe button here on my YouTube channel so you get all the information I'm putting together for you that's going to help you on your journey back to health, going to help you in moving well and reaching your best potential. And I hope to see you next week. Have an awesome day.